When I saw those papers that he actually treat the rectal cancers with radiation on its own without any surgery, I was surprised, and basically I didn't actually believe that. But then I was curious about his results because he's done it over such a long period, and there were numerous papers that came out, so my curiosity was aroused. Then my professor, Rossili, asked me what I want to do. I said I want to go and see Professor Papillon in Lyon. And he said, why do you want to go and see him? So I said, well, he states that he can actually cure rectal cancer with radiation. And I said, I don't believe that. And Professor Seeley laughs and he said, yes, I've seen it and I believe it. So I said, I haven't seen it and I don't believe it. And Professor Seeley said to me that, Sonny, we don't have a facility in UK at that time, and you must promise me one thing. You go to Lyon, see Professor Papillon, you learn all the technique, but you must bring the technique back into UK and set a facility up in UK. And not knowing what I was agreeing to, just because I want to go to Lyon, I said, yes, of course I will. Professor Papillon was quite old, and he said he doesn't do a lot of clinical work, that he had got a protege, Professor Jean-Pierre Jarrard, who he introduced me, and Professor Jarrard took me in and showed me, his clinics, and that was my inspiration, and I, first time seeing it, and it was quite exciting for me.
Certainly it would give me enormous pleasure and pride to cut this ribbon and declare the Papillon Suite well and truly open.
Up to 3 minutes for 30 degree.
You ready?
Yeah,
I'm
ready.
Right. Now, if you stand over here, then you can see from the side the position I want you to get into. Right, you don't laugh at me and I won't laugh at you. Okay, so just come forward, so stand here.
I had the pleasure to meet Professor Sunmint in 1992. And he was very, very clever, very, very well persistent to work in that field, which at that time was not at all popular. And thanks to his continuous effort to improve the technique, he is now the heart of contact therapy in the world. He's treating more than 100 patients a year. I treat for myself 10 to 20. And the results he achieved here in Liverpool, Clatterbridge are very great. And there is so many patients who are grateful to him for controlling the tumor, preserving the rectum, having a normal life, which is the best we can achieve in medicine.
And we are picking up a lot of the early stage cancer through National Bowel Cancer Screening Program that is going around all the Western countries. Because the disease stage is changing, we should change the concept of management of rectal cancer, and this is what I'm trying to do. Well, patients should have a choice because the standard of care is surgery, and all patients are being told that the best way to cure cancer is surgery, which is true. But there are patients who are not fit for surgery, who are not keen on having surgery because of the stoma, and these patients should have a choice for the treatment. Important thing is after the treatment with contact radiation, if there is still a residual tumor, we could salvage them successfully with surgery, and we're preparing a paper on that. So that will be a game changer if all the surgeons would accept that.
If you're actually one of the patients that really needs this treatment, can you physically make it to a Papillon centre? Choice has been taken out of your hand. Even though you might qualify for the treatment, I've got doctors from Anglia and stuff here, but unfortunately I have to send some patients to Liverpool or Guildford or Nottingham. So are we letting people die simply because they physically can't make it to the doctor, or they're geographically living in the wrong area? That's not patient choice. That's just bad positioning.
We occasionally use fentanyl if patients are in an awful lot of pain. But we've probably only used it on about 30 patients of all the ones that we've done. I think surgeons really do need to reassess their approach because they have to take into account patient choice. There are many people when they have early rectal cancer that aren't willing to have a full AP resection, and it involves giving up a lifestyle. You know, they might have been into all sorts of things, hobbies, whatever. It has a really real impact on your way of life. So if you can find any way that you where you can avoid having a colostomy bag, you're going to try it. So they must give the patient that information. If it isn't successful, they can always revert to surgery. But I think it's a no-brainer. I think any patient would want to try everything first.
Some patients have a lump of fibrosis that you can mistake for a residual tumor.
Well, I'm a surgeon myself, so I'm telling surgeons that there are alternatives, and we're practicing alternatives and showing them the results. Well, we've started introducing Papillon in the Netherlands because we run an organ preservation program where we try to avoid unnecessary stomas, unnecessary surgery, and we feel that adding the Papillon technique would increase the proportion of patients where we can successfully do that substantially.
Well, it's always a pleasure to come to Liverpool to see Sonny, and especially on this special day where he's celebrating 25 years, so many congratulations to the team from Liverpool. So in terms of results, patients who've had local excision.
In our experience, it's very safe, so we've treated over 100 patients. Most of those patients have done extremely well, and in the long term have also got very good bowel function. I think radiotherapy's advanced a great deal in the last 50 years, so treatments are getting more effective, and we're also more conscious of the long-term complications of our treatments. So treatments like Papillon are ideal for the 21st century.
It's all done now.
Thank you. I don't feel too bad, actually. That was okay. Thank you.
Okay, Andrew, I'm going to show you what the tumor looks like if you want to have a look. Yeah, that got the full dose of radiation today. And that's going to work for a few weeks. And when you come back in 2 weeks' time, you'll see that the tumor would have shrunk, significantly. If you're responding. If you just give external beam, there's about 30 to 40% risk of local regrowth, as we call it. By doing this contact radiation, we can reduce those regrowths down to about 11%, which is considerable. This is a good response. It's much flatter, which you can't see very well.
Fighting with the establishment to try and find the voice for the patients who are not keen to have major surgery, refusing surgery. The patients' voices are finally being heard, and this is a prize for them.